Hello, and welcome to the Ovarian Club, a glimpse into conversations between two besties across countries, South Africa and France, tackling the trendiest women's wellness topics through a scientific lens.
Join me, Dr Tarryn, and health expert Emma as we explore delicate subjects related to the women's health space.
We started this podcast to share our conversations to help navigate the complex women's wellness world. We hope you enjoy the podcast and take away as much from it as we've enjoyed making it.
The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. So, my follicle friends,
let's begin.
So, Ta, hey Em, how are you?
I'm good. I'm very excited for a second session, which is following up from a previous episode on perimenopause, which partially freaked me half to death, but that's fine. Still recovering. You did not take away all my fears and woes, so hopefully this episode will. But we are speaking today on menopause. Menopause. I have to be honest with you. I have done a bit of research, but before doing that and before chatting to you, as with perimenopause, very little understanding of it. Kind of just thought menopause is hot flushes, a woman reaching middle age doesn't have her period anymore, but really didn't understand much about it. So historically, menopause only accounted maybe for 1/3 of a woman's life, if that's right. Whereas in today's world with modern medicine, it accounts for even maybe half of a woman's life, which is an enormous amount of time. And I think it's such a misunderstood topic. We're going to dig into it today. We're going to talk about what menopause is, what happens in the brain with menopause, what happens from a hormonal standpoint, how it differs from perimenopause. We'll go into that a little bit, into hormone replacement therapy, evolution, which is super interesting. We're some of the only species with menopause other than killer whales, which is fun fact of the day.
Very interesting. We are very unique as Homo sapiens.
Let's dig in. There's so much to talk about in this topic, so hopefully we'll manage to get through it in one session. As a disclaimer from me, although I do work for a pharmaceutical company, any views expressed on the show are purely my own and not reflective of my company or any companies that I may be invested in.
Definitely lots to get to in this session. Really been looking forward to it. We're exploring, how we can best optimize women in their menopause years and beyond. And there's hope. There's hope for the future because the paradigm is shifting. And yes, just before we begin, I need to state my medical disclaimers as always, that although I am a qualified medical doctor, the podcast does not serve to offer any personal medical advice. So always seek the advice of a healthcare professional with regard to any condition or treatment you may be seeking. And yes, while we do strive to provide accurate and up-to-date information, the content discussed should never be used to diagnose or treat any health issues and is relevant as of March 2025, always subject to change.
Fantastic. So thanks for that. Let's go back a little bit. We talked a little bit about perimenopause in our previous episodes. For those of you who haven't listened to that one yet, please do go back and take a listen. But let's just level set a little bit about what menopause is.
Right. So menopause, simple terms, 12 months to the day following her last menstrual period. That marks the official date of menopause. And menopause, it's a natural biological process that signals the end of her reproductive years. Simple as that. The average age is 51, although it has a very big range, 45 to 55. So menopause can be earlier for some, later than others, but yeah, average age is 51.
So what we also discussed in our previous episode was perimenopause, and that's that lead up towards menopause. Correct me if I'm wrong and I'm misquoting anything, but 4 to 10 years, you start getting the symptoms, the hot flushes, you're getting a fluctuation of the estrogen and progesterone that then leads you into menopause, which is triggered on one day when you no longer have had a period for 12 consecutive months.
Yeah, you got it.
Why does this happen?
Well, that's a very good question. So there actually are two hypotheses that suggest that menopause has evolved to facilitate a woman's transition from a reproductive role to that of a supportive role, a nurturing role, to take care of the offspring while the men go out and kill animals. In assuming a caregiving role and fulfilling a more productive member of society, women have evolved. And this is known as the grandmother hypothesis, right?
So hold on. Can I stop you there for a second? So that's evolution is changing the role of women in society, not evolution is causing us to have menopause.
Well, evolution is dictating that we should undergo menopause in order to assume a caregiving role.
Okay.
So that's one hypothesis. The second one is that in women undergoing menopause, they no longer can fall pregnant, which is obviously like the biggest risk factor in a woman's life. So it's best that they undergo it so that they don't have to face this threat in their older years when they're already more vulnerable. And this is known as the end of reproductive life hypothesis. Are you aware of males undergoing anything similar? Like poor men, they also have to have their own term called the andropause. Have you heard of the andropause?
I have not heard of the andropause. I've heard of a midlife crisis, but not
might be equivalent. But essentially, men like to deem their transitionary period as the andropause. And this marks the drop of their androgens, remember the male hormones, testosterone, which is not comparable to the drop in estrogen and progesterone, as well as testosterone, that women are faced with when they enter into this transitionary period.
So males do go through this, and I didn't mean to sound a bit condescending with my midlife crisis theory, but so in a sense, then there is actually something in terms of the fluctuation of the male hormones, the androgens, which could maybe then impact behavioral changes or
subtle physical changes like a bit of weight gain as well, fatigue, loss of muscle mass with the drop in testosterone, irritability, depression as well. I mean, it's seen with males, but far less marked than in the case of women who undergo rapid drops in their hormones very suddenly.
So tell me more around symptoms of menopause. What kind of woman expect when she does hit menopause?
Right. So the most common reported symptom is actually hot flashes. But interestingly, only 20 to 30% of women seek medical treatment for it. So hot flashes, they can actually begin in the perimenopause stage, but it's quite marked in menopause. Not all women experience it, but for those who do, the symptoms can be quite debilitating, really. They can last for up to several minutes per day and even occur throughout the night. And basically, it's characterized by a sudden increase and then decrease in body temperature. It can be really, really debilitating for women because it can affect their sleep, their mood, and then soon we'll explore the depression, anxiety symptoms that can sometimes pop up in the menopause period.
And do we know what causes the hot flashes?
So, yes, we postulate that it's due to the drop in estrogen that happens in the brain, right? So the estrogen levels drop. And when they drop, they no longer can activate the hypothalamus, which regulates body temperature in the brain. So if the estrogen's not there, the hypothalamus is poorly regulated and then cannot perform its job properly. And this is why a woman experiences flashes.
You said the hypothalamus is impacted by the estrogen job. Are there any other effects in the brain? I was hearing studies that does suggest that there's an increase in the Alzheimer plaques. So a woman is more likely also to get Alzheimer's because of the brain changes. Can you break that down a little bit? Talk to me more around what happens in the brain.
Yeah, so as you correctly said, 2/3 of Alzheimer's patients are women. So that is true. And it is thought to be associated with menopause, but not yet confirmed. Studies are actually still ongoing. But essentially, what else happens in the brain is that when the estrogen levels drop, it can no longer also activate the brainstem, which is what is responsible for sleep as well. So this is why there could also be sleep disturbances. And another area in the brain that the estrogen now no longer can regulate well is the amygdala and the hippocampus, which is responsible for mood symptoms, and it's the emotional center of the brain. And this is why women are more likely to develop anxiety, depression in the menopause period.
That's super interesting. I think in the previous episode, you mentioned that even women with absolutely no history of depression are suddenly getting depression during either perimenopause or menopause, which is quite crazy. If you do have an underlying history of depression, anxiety, all of this, or any mental health issues, would that become worsened during menopause? Do you know?
Yes, you are at an increased risk of developing worsening symptoms in the menopause period.
That's something also really important for families to be aware of too, right? That all of this stuff that's happening to maybe your mother or to a loved one, that this may also exacerbate some of the symptoms during the menopause period, and really to encourage your loved one to get the help that they do need, whether that's psychological, antidepressants, whatever that may look like. Because I imagine with all of this that a woman's going through, sleep deprivation, the hormonal changes, the psychological changes, also being in a stage of their life where they're ending the reproductive phase. It's so many life changes too. That's a lot on a woman, but then I imagine it's also a lot on the family being around, and it can create those disruptions within the family. So being aware of this, I think, is so important, and being sure that you are able to get your loved one the help that they need, and that you're also aware of where some of this is coming from.
Yeah.
And can address it, hopefully. Are there other symptoms that maybe carries on from perimenopause, or that is more specific to menopause? Is it predominantly the hot flashes, or is it also depression, the changes in the brain?
Yeah, there's loads more. How much time do you have? There are loads more, but let's go through them. So have you ever heard of vulval vaginal atrophy, formerly known as senile vagina? That's modern medicine for you. Have you heard of it?
Is that the vaginal dryness and discomfort during intercourse?
Yeah. So, or actually just in general, like with or without intercourse, the inner lining of the vagina thins, dries, it might be a bit irritated. So this happens due to the drop in estrogen in the vagina. So our vaginas are very sensitive to these dropping estrogen levels. Yeah, so this is a very common symptom that's reported. And then as a result, women are predisposed to more UTIs because of the change in the vaginal environment, the vaginal flora. So there is treatment available, the ones that you apply topically in the vagina to buff up the vaginal walls. A systemic hormone replacement therapy, like taking a pill, putting on a patch or a gel, is not going to fix your vagina. Right? You actually have to put a lubricant, like a topical estrogen there.
So what you just mentioned was like a hell of a lot with regards to the sexual health.
Who would have thought? Okay. A very interesting symptom that I was unaware of is a dry eye disease. That's also thought to be related to an estrogen deficiency. So estrogen receptors all over the body, and that includes the joints. So often joint pains and shoulder pains kick in the menopause period. And it's not simply degenerative arthritis. Well, I mean, one would have to exclude that. Doctors must be very careful, actually, not to say, okay, it's menopause. You know, they actually have to do a full workup, of course, but it is often due to dropping estrogen levels. So those are like common, like intermediate symptoms. And then what happens are the long-term consequences of an estrogen deficiency, and then bone loss. It's not going to happen overnight. It's going to be more over years of reduced estrogen.
So if I can just summarize what I'm hearing so far, hot flashes, very, very, very common symptom that is caused by the estrogen, which creates disturbances in the brain, in the hypothalamus, which regulates the temperature control. You also then have other changes in the brain caused by the estrogen fluctuations, which can then impact the mood. So you're seeing more increases of depression, anxiety, and we have then the dryness of the vaginal walls, which creates discomfort and also more UTIs. You also have the aches and pains, and then we get into the longer term effects of a lack of estrogen, which could be bone density decreases.
And then individuals are predisposed to fractures. They also have cardiovascular disease. So the risk of cardiovascular disease increases after menopause years and beyond. It's interesting to note that actually estrogen is protective of our blood vessels. And so when they drop, we are at an increased risk of cardiovascular disease. And then, of course, body composition, we kind of touched on in perimenopause, but, changes in the fat distribution. It's now centered more around the abdomen, which is the dangerous, place. You don't want it there. Visceral fat.
Are there any other effects in the brain?
Yes. I'm glad you touched on it. So actually, while epidemiological evidence suggests that estrogen is important for cognitive function in women, the consequence of hormonal changes during the menopausal transition remains uncertain. So we don't know if it's because of an estrogen deficiency or if it's just, due to another pathway. But yes, women do report lapses in memory, poor verbal recall, but it does seem to be transitory, like more in the perimenopause, like dipping into menopause stage. And then once you're in established menopause, it's up for debate whether cognition is actually impaired or not. We know later on if they develop dementia, Alzheimer's, that's a different story. And again, we don't know yet conclusively whether that's because of an estrogen deficiency or not. It could be due to other factors as well. So it's a bit of a disputed area.
I was hearing that because of the changes also in the woman's brain and what happens from a hormonal standpoint, women also have post-menopause more emotional regulation. They are also less quick to temper. There's a lot of really positive changes, right? So there seems to be this period of perimenopause going into menopause. And then I don't know how long once you hit post-menopause where the positive stuff starts happening, and what is that positive stuff? Can you tell us?
Yeah, no, that's very valid. Basically, again, if I can illustrate on a graph, in perimenopause, the hormones are like fluctuating up and down. So it's a very volatile period, especially with regard to mood, anxiety. I mean, this is actually when a woman is most vulnerable. The period following menopause is actually termed postmenopause. However, postmenopause can further be subdivided into early postmenopause and late postmenopause. The first half for women is kind of recovering from that, perimenopause transition, where the hormones are slowly starting to stabilize, but they're not quite there yet. And then ultimately, eventually, they stabilize. They're still way lower than pre-menopause levels, but at least they're not up and down, and they're actually like fairly consistent. I mean, not everyone feels this way, but there have been self-reported studies, questionnaires asking women about their experience post-menopause. And a lot of them had very positive symptoms to say, so like contentment with life, doesn't give a damn attitude, kind of just lives for herself. So there's definitely hope once we get through it.
Silver lining, should I say.
Also important to mention at this stage that not every woman's going to experience these symptoms. Some women go through perimenopause and menopause completely symptom-free. So don't fear this if you're listening to this episode. You may be some of the lucky few who just cruise through.
Oh, I was hearing somebody talking about their experience with menopause, and they were comparing it to when you go through puberty, people tend to celebrate, you're becoming an adult. When you go and you're pregnant and you're having all these hormonal fluctuations, people are celebrating the fact that you're going to give birth. So if you're grumpy or you're in a mood or you're tired or whatever, people are like, she's pregnant. But there doesn't really seem to be this respite or this level of empathy for women going through menopause. It's also, I think, something, especially in our mothers' generations, which they didn't really discuss, or certainly wasn't something that was open. I think it's definitely changing. People are talking more about entering into perimenopause and menopause phases, hot flashes, etc. But it's still really not something that is widely discussed, and it's certainly not celebrated in our society. And that must be exceptionally difficult for a woman going through all these different symptoms that you've just mentioned to have to face that, and then also somehow keep it suppressed, or it's sort of got a negative connotation in society.
Absolutely. That is so eloquently said. Couldn't have said it better myself. Menopause is also, it's interesting how it does differ across cultures. So those people stemming from collectivist cultures, usually in the East, it generally does tend to be a little bit more celebrated in that women kind of gather together and bond in their traumas, I want to say, but no, in their experiences, slightly more accepted. I believe, than in Western societies, Western cultures, where nobody talks about it. Women suffer in silence alone. But yes, you are right. It's definitely changing, and there's a lot to feel optimistic about.
And are there certain things that women should be considering as they enter into the menopause phase that can also help to mitigate their symptoms? Because, I mean, you mentioned a lot, and one of them also, I mean, like sleep.
Yeah, so sleep. Yeah, I mean, I'm really glad that you mentioned that, because we should expand on that, because it most certainly can further exacerbate a woman's anxiety. The sleep disturbances are often attributed to hot flashes. Not always. I mean, there could be underlying sleep disorders, insomnia, restless leg syndrome. Definitely consult a healthcare professional. You can make that assessment. But often when it's attributed to hot flashes, you're just not sleeping because you're waking up throughout the night.
Because hot flashes are the main causes of sleep disturbances, as opposed to...
In menopause, yes. Yeah.
Okay.
Yeah. I mean, there's also obstructive sleep apnea. I mean, there are other reasons, but definitely a common reason for poor sleep is hot flashes. So I remember in my mom's day, like anecdotally, people would say, must dress in layers, that you can take off the layers one at a time. You can use fans, avoid trigger foods like spicy foods before bedtime. These were, anecdotal suggestions that was word on the street to improve your sleep. But yeah, all those like anecdotal suggestions are no longer accepted by the Menopause Society, actually. So, I mean, if you want to do it, if it works for you, go ahead and do it. But the best treatment for this is actually to restore the estrogen levels, hence not have the hot flashes and have a better night's sleep. So, hormone replacement therapy. Of course, there are other, medications that one can use, like magnesium glycinate is very good for helping sleep.
Super interesting. Are there any other things that a woman needs to, or is it just as simple as like, hey, go to your doctor and speak about hormone replacement therapy?
No. There's lots of lifestyle factors. And remember, hormone replacement therapy is not the be all end all. I mean, I'm a huge advocate for it, but it serves a time and a place. Hormone replacement therapy is good for hot flashes. We know it is good for improving mood symptoms. We know it's good for bone density, for improving cardiovascular health, if initiated within 10 years of menopause.
So they would start that in perimenopause,
ideally, or early menopause. Or early menopause is fine. Within 10 years of menopause is actually fine.
Okay.
Yeah. So it's got to be initiated early on when a patient does not have established risk factors and also has no contraindications to starting hormone replacement therapy. So not everyone can take estrogen, and this includes women with active breast cancer. We would be cautious about giving hormone replacement therapies, as well as liver cancer and, current clots in the leg and established cardiovascular illness.
Okay.
But remember, hormone replacement therapy doesn't treat, all the symptoms that we alluded to earlier. For example, it's not indicated for the treatment of dementia or poor cognitive function.
So hormone replacement therapy is a really good solution for your hot flashes, for bone density, for some of the other symptoms that you may be undergoing, but it certainly is not a fix-all.
Mm-hmm. So I just want the whole world to know about how estrogen can be administered. So estrogen is given orally, although doctors most certainly do prefer the transdermal route, so through the skin, because this bypasses the liver. And by bypassing the liver, you really do reduce that risk. So basically, transdermal estrogen is really, really safe. There was concern for breast cancer, but the studies now have shown that it does not appreciably increase the risk of breast cancer, provided you don't, have active breast cancer.
What else can we look at? Are there any alternative therapies that women can look into? Acupuncture, supplements? What else could they do to supplement that? Excuse the pun.
Really glad that you mentioned that. So basically, all those alternative therapies are not advocated for. I mean, sure, placebo effect, if it works for you, it works for you, but it's not known to alleviate menopause symptoms. So acupuncture, no. Supplements, I don't know if you've heard of black cohosh. This is relatively popular alternative therapy that's available to supposedly reduce hot flashes. But the medical community is concerned for black cohosh because it's thought to sometimes affect the liver function. So definitely, inform a healthcare professional if you are opting for a supplement. And then I know I'd heard of evening primrose oil. It's a rich source of gamma-linolenic acid. It's widely used in postmenopausal women, also to treat hot flashes. Unfortunately, the data here, though, suggests that it was no more effective than placebo. So in other words, if it works for you, do it, fine, but it's not actually that effective.
There's no scientific backing behind it.
Yeah.
And then additionally, there's also the lifestyle elements that can be incorporated, like stress management, exercise, diet. Really, really important.
Yeah. So take this advice, and that is fix your diet. So eat a diet that's rich in antioxidants. Blueberries are apparently phenomenal for the brain. The brain gobbles that stuff up. So blueberries, raspberries, omega-3s are really, really good. So if you're not getting enough of it from the diet, then you can consider supplementing with omega-3. And also your vitamin Bs. Especially if you follow a vegan diet, you're deficient, definitely make sure that you're taking in enough vitamin Bs, because it's very good for, neuronal health in the brain. So those are just like a bit of supplements, but also cortisol, we know, is very, very damaging in all of the body, not just the brain. So we want to try and mitigate that. So we want to, implement stress reduction techniques, mindfulness, yoga, Pilates, and regular exercise. Like, exercise must not stop, even when you're in menopause. Like, don't tell yourself, no, I can't do it because I'm old and haggard now. That's absolutely nonsense. You must move your body always and do all the things like, sprinting, head training. All of that is so beneficial. Spurts of energy, get that heart rate up, protect your cardiovascular health always.
So high antioxidant diet. I'm so happy you said that, because it does justify me spending an absolute small fortune on blueberries and raspberries, which is my absolute guilty pleasure, but extortionately expensive in Europe. And so high antioxidant diet, and then stress reduction, as well as frequent exercise. And then there is a hormone replacement therapy, which we spoke about.
So it's just to note that if you are going to take estrogen in whatever form, if you do have a uterus, you will also be prescribed progesterone, and that is to protect the endometrial lining and of the uterus and prevent endometrial hyperplasia and cancer.
Just to wrap up, we've spoken about so much. We spoke about why we go through menopause, the evolutionary factors. We've spoken about the fact what the symptoms are. So hot flashes being the predominant one that does also cause sleep disruptions, as well as mood instability. But then you've also got changes in the brain that occurs. Well, the hot flashes are caused by the estrogen that triggers changes in the brain. Additional changes in the brain caused by the hormonal fluctuations, which can also create anxiety, depression, further sleep issues potentially. You also have the vaginal dryness, drop in libido, a lot of different symptoms. Sounds like hormone replacement therapy is a really, really important treatment mechanism that can be utilized.
But there's also so much whack out there. So women deserve to know what is evidence-based, what are doctors using in clinical practice, and to make informed decisions from that point on. Just chat to a healthcare professional, know about this option at the very least, and then you can make an informed decision. And I think we can wrap up.
So thank you everyone so much for listening in. We covered a lot during this topic on menopause. We're really excited for our future episodes, which we have a really exciting lineup, including episodes on sleep, on Botox, preventative aging, whole list of other episodes coming your way soon. So we really hope you enjoyed this episode as much as we enjoyed preparing for it. We really wanted to create a platform, especially for our South African women, to talk about healthcare topics and wellness topics that is presented in a way that's easier to digest. There's just so much misinformation. Do not forget to hit subscribe, and do give us a follow at the Ovarian Club on Instagram, and shoot us any questions that you may have, any topics that you're also interested in us breaking down further. So thank you.
Thanks very much. The Ovarian Club, powering life, nurturing health, shaping sustainable wellness. See you soon, follicle friends.